started a partnership with Columbia University, and that partnership would see us doing a longitudinal study for about 5 years. We'll officially launch this study in November of this year. We have some of the world's best researchers from Columbia University who would be joining persons from the Ministry of Health here to do a complete study over the next 5 years about the risk factors relating to suicide. And while they're doing that is to come up with programs of how we can mitigate against some of these factors.
The local health minister during his daily COVID-19 update. World Mental Health Day 2021 will be observed on Sunday, October 10 under the theme Mental Health in an Unequal World. But even as the day swiftly approaches, Guyana has a long way to go with regards effectively responding to mental health and its challenges. As such, the minister is optimistic that this study, which is being funded by the National Institute of Health, will provide the tools needed to competently deal with the challenges of mental health. It was noted that while Guyana has managed to lower its suicide rate, the figure is still relatively high and that needs to change. In a 2014 report by the World Health Organization, Guyana was cited as the country with the highest suicide rate in the world, 44.2 suicides per 100,000 deaths, 4 times the global average. However, in 2018, that figure was drastically decreased to 18.9 suicides per 100,000 deaths. The minister opined that one of the key contributing factors to Guyana's high suicide rate is the inability of medical professionals to recognize the signs of mental health disorders. To this end, it was conveyed that the ministry has been facilitating a number of programs to correct this.
One of the things that we've been working on is really to train physicians at the primary healthcare level so that they would be more sensitive in their recognition of mental health illnesses. As it is, there are lots of people who would probably come to our outpatient, primary care outpatient clinics, and they would go unrecognized for things like depression and so forth. So we want to get people better trained to recognize these conditions.
Additionally, a number of psychiatrists and psychologists have been recruited and trained by the health ministry.
Over the years, we have also been able to train more psychiatrists, and we are also recruiting on staff more psychologists and clinical psychologists so that we can help with counseling and so of patients.
On another note, the minister also used the opportunity to laud the recent approval of the world's first malaria vaccine by the World Health Organization.
We are going in the right direction. As you know, malaria, especially falciparum malaria, has been responsible on an annual basis for close to 500,000 deaths. And among those deaths, you probably have every year about 360,000 children dying from falciparum malaria. So with this particular vaccine that they've developed, it is going to help to reduce the amount of deaths that we are seeing.
The minister shared the belief that this vaccine will pave the way for the creation of more vaccines against parasitic diseases. Meanwhile, with regards to the country's ongoing vaccination drive, 366,190 adults, or 71.4% of that population, have received the first dose of a COVID-19 vaccine, while 220,117 adults, or 42.9% of that population, have received both doses. Additionally, 25,615 adolescents, or 35.1% of the adolescent population, have received one dose of the Pfizer vaccine, while 14,679 adolescents, or 20.1% of the population, have received both doses. Reporting for the HGP Nightly News, Kendell Richmond.